Hello everyone. I'm here with our case today. The patient came in with pain in the lower left side in the molar region, back tooth region. So we did an examination and we took an intraoral radiograph. And in the radiograph, you can see the lower second molar has been root canal treated. It has been crowned, and also there's a lesion associated with the distal root of the second molar. So after discussing it with the patient, we plan to do a retreatment through the crown, and that's what we did. We made an access through the crown. We did the BMP again, and this is how the master cone looks. The master cone was especially in the distal canal. The apex was larger, and the GP has gone beyond the apex. And then after the correction, this is how the final obturation looks. So did this retreatment in a single visit, and it has almost been 6 months we have did this treatment. We were not able to call back the patient to the clinic, but we have done a overcall consultation with the patient, and the patient has no symptoms till date and is completely comfortable with this. Now coming to the differences, where did it actually go wrong? Where did the previous treatment go wrong? What's the reason for that? Only during the retrieval did we understand that there was no problem with the working length. The only problem was with the selection of GPs and the quality of obturation. While doing obturation, they only considered the length. The length during their previous treatment was okay. It was not too short. It was only short by 1 mm, which is natural. But the problem was with the seal at the apical part or the seal in the canal, because the minute we placed the H file into the GP and pulled it out, the whole GP, especially in the distal canal, came out in one stroke. It did not take more than 2 minutes to retrieve that GP. That was how poor the seal was in the previous treatment. So this again proves that when you don't properly seal the apex, you will see the patient back again with pain. So when there is no proper apical seal, there is no proper treatment that has been done. So it's always very important to seal the apex properly to achieve the maximum apical seal and to reduce the risk of reinfection. Now you look at the difference between both these obturations. When you see, I'm again focusing specially on this distal canal. You see the amount of GP, you see the width or the diameter of that GP present in the previous treatment, and look at the amount of GP that has been uh, accommodated in the canal after the retreatment. This was how large the canal was, and this was what made all the difference to the patient. So make sure whenever you are doing any root canal treatment, it is equally important that you seal the apex properly. It's not just in the length. Even though you have did your working length properly, even though your BMP is done properly, when you don't do the apical seal properly, there again is a risk of reinfection, and there is always a risk of failure of root canal treatment. So that's it for today, guys. We'll meet you soon with another video. Thank you.